Hello, 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 hello. Good evening, good evening, good evening, friends and loved ones. It's another wonderful evening, and I'm glad to come to your homes once more again as we talk about another condition. Yes, it's been weeks upon weeks upon weeks upon weeks. I've been having so many discussions. Yes, we started with scoliosis, we moved on to arthrosis, we talked about Bell's palsy, we talked about so many conditions. The recent condition we talked about was what about delayed developmental milestone. Yes, and then so many conditions we talked about. We talked about flat foot, many conditions, and today is not an exception. And we are going to talk about a very interesting condition. Yes, it's called carpal tunnel syndrome. Carpal tunnel syndrome. Yes, it's a very interesting topic, and then I'm sure that we'll learn a lot. We'll learn a lot from it. So thank you very much for your time, and I'm sure that we'll have an interesting moment today, this evening. Okay, so we begin the topic. Yes, so the outline for this presentation is, yes, first of all, having an introduction to the topic, and then a quote, and then acknowledgement of those listening to us, and then the meaning of the condition, the prevalence, the signs and symptoms, the location, the exact place, and then the clinical anatomy, that is what is in the structure, and the risk factors. We're talking about the epidemiology, the disease itself, and then various investigations, that is diagnosis to the condition, and talking about outcome measures, how to see or measure the rate of progression of the condition, whether it's getting better or not. And then we are going to talk about some special tests, and then treatment, and then how to manage it, various life modification styles, that is lifestyle modifications, and then surgery where the condition is very severe and there's virtually nothing to talk or to do about. And finally, we're talking about our next topic. Yes. Okay, so I'm very glad to present to you this condition on carpal tunnel syndrome. Carpal tunnel syndrome. So as we've been talking about, before we delve into the condition, we're going to break the name into parts: carpal tunnel and syndrome. Yes, carpal tunnel and syndrome. Carpal is a group of bones in the body, specifically at the wrist. So at the hand, when we talk about our forearm, this is the forearm. So we have two bones in the forearm, and then in the wrist, so we have bones in the wrist, and then we have bones in the palm. Yes, and then we have our finger bones. So the bones in the forearm, this part of the forearm, are composed of two bones. We have the radius and then ulnar, and then in the palm we have bones. We call them metacarpals, and then in the fingers we have phalanges. But today we're talking about mainly a condition that affects a region in the body called the wrist. Yes, in the wrist. So the wrist contains bones that we call carpals. So in a very short moment, I'll show you the carpal bones, and then we'll be able to appreciate. So the carpal bones. So we have bones in the wrist that we call carpals, and this will help us to be able to understand this condition. Okay, so this is a pictorial presentation actually of the condition. So the carpal bones are just a minute. Okay, yes. So we have the carpal bones. So just a look at the carpal bones here. So we can see the carpal bones here. Yes, so this is the carpal bone. You could see them, the bones. These ones are all carpal bones. Yes, this is all carpal bones, and they form part of the wrist. These ones are all carpal bone. Yeah. This one's the carpal bone. This is carpal bone. This carpal bone. This carpal bone, and they are all structures in the wrist that gives yes, that gives shape to the wrist, and then helps us to connect the palm and then the forearm. So the forearm and then the hand are connected by the wrist. This one, this is the wrist. So without the wrist, I don't think we can write. Yes, without the wrist, can write. So this is a few description of the condition. So carpal bones are very, very essential as we talk about this condition. And then tunnel. When we talk about tunnel is like a space that something passes to. So we have a tunnel where a train passes. So underground. So you have an underground tunnel. And the syndrome is a condition or a condition that affects a particular part of the body. So a syndrome. So when you talk about carpal tunnel syndrome, it's a condition that is affected at the wrist region, and then we will delve in to talk about it within this presentation. So carpal tunnel syndrome is a compression of a structure that we call a nerve in the wrist. So in the wrist, we have structures in the wrist. We have muscles, we have tendons, we have ligaments, we have nerves, we have blood vessels, and we have bones in the wrist. And these structures are very important to enable us function very effectively. But this today we are mainly going to talk about a structure called a ligament, a transverse carpal ligament. And this structure is very important because it covers protects the blood vessels and the nerves and prevents them from injury. Yes, so that is transverse carpal ligament. So it's very important as we talk about this condition. And then secondly, the median nerve. So a nerve is a structure in the body that helps to give us sensation. So the median nerve is very important. So now we are talking about the clinical anatomy. That's the anatomy of the wrist. So you have the muscles, we have the tendons, we have the ligaments, and then we have the nerves. Yes, so these structures are very important for us to function very well, and then it enables us to write and enables us to pick things from the ground and pick things from one place to the other. So carpal tunnel syndrome is caused by compression of a nerve. So the nerve is called the median nerve. So the median nerve is found in the wrist. So if you look at the wrist, inside my wrist we have a structure we call a median nerve. And this is very important. That gives us sensation. That is, so we are able to feel things when we touch our wrist. So if I touch my wrist like this, yes, the fact that I'm feeling something in my wrist, that shows that my nerves. So the chi, we say in the Ghanaian language, we have the chi that is mostly predominant, or the Ghana language that we call fajin. Yes, they give sensation. That's called nerves. They give sensation to the body, and this particular nerve is called the median nerve. It's found in the wrist, and then some portions are found in the forearm. Yes, so this is the forearm. So this gives sensation to the wrist and then enables the wrist also to function very effectively. So when this nerve is affected, we will have certain problems that we will talk about during this presentation. Yes, so this is a few anatomy of the condition. So they have the wrist, they have the bones, ligaments, tendons, nerves, and the transverse carpal ligament. Okay, so this condition actually presents itself such that you see symptoms. So when we have a condition that we're talking about carpal tunnel syndrome, we have signs or symptoms. So the patient comes or the person comes to the hospital and he says, "Oh, I can't feel well in my wrist. I feel pain in my wrist. I feel tingling sensation in my wrist, in my hand, in my arm." And the pain I'm feeling on my left wrist is different from the way I'm feeling on my right wrist, or I'm feeling extreme pain in my wrist. And then we can do other tests to be able to confirm that yes, this condition is mainly the carpal tunnel syndrome. Other than that, we have to look at other conditions. But then this condition is very, very important because it affects a lot of the working population in the society, and this is very important that we have to take care. So carpal tunnel syndrome, you're talking about a condition called carpal tunnel syndrome. So when we talk about the pathophysiology, that is the condition itself, where it affects. So the condition affects the thumb, it affects the index finger, it affects the middle finger, and affects a portion of the ring finger. So the ring finger. So we say it affects the radial aspects. So the aspects close to this side. Yes. So the aspect close to the thumb. So it affects mainly this portion of the ring finger, the one closer, the half part of the wrist. So if you look at the fingers, the half part of the ring finger that faces the thumb is a portion that it affects most. So when you pass your hand through the thumb and you pass your hand through the index finger, the person or the patient sees that, oh, I don't feel well there. The way I'm feeling is different from the way I'm feeling on my left hand, where it's not affected. And then the main presentation is the complaints of pain. So pain or lack of sensation at the portions of the finger closer to the thumb. Okay. So we are talking about the signs and symptoms. So the person presents himself with pain, with tingling sensation. The person complains of different feeling on the affected wrist, and then sometimes pain that comes as far as to the forearm, and this could present itself also as carpal tunnel syndrome. So some of the causes of carpal tunnel syndrome are inflammation or thickening of a structure in the wrist that we call flexor tendon. So we have tendons in the wrist that run through the wrist. So just a picture of what I'm talking about, that will give us a very good understanding of what I'm saying. Yes, so this is a presentation. Okay, so as we said, we talked about the transverse carpal ligament. So this is the transverse carpal ligament. So when you say, so this is it. So it covers the wrist, so you can see it, and protects the structures inside. And this is a very good presentation. So you can see it here. So you see this structure called the transverse carpal ligament. It covers the structures in the wrist. So this yellow thing that you're seeing here it's called nerve. They are nerves that run through it. So one of the causes of carpal tunnel syndrome is that we have inflammation. So inflammation means the place has become red, the place is painful, the place becomes hot, and then there is likelihood of swelling around that structure. So we have swelling around the wrist. So this could mean that the person or the patient would have had a carpal tunnel syndrome. Okay, yeah. So the person has inflammation around the wrist region. So the person would likely be diagnosed to have carpal tunnel syndrome. Okay, so carpal tunnel syndrome. Yeah, so we are still talking about the condition. Then secondly, the doctor is, or the medical practitioner is able to diagnose of the person having fibrosis surrounding the structures around the wrist. So if you look at my wrist, there could be fibrosis, that is thickening around structures in the wrist. So there are structures that we call tendon, flexor tendon, and this flexor tendon helps us to bend our wrist like this. So if there is thickening of the structures around that side, they could cause pain or they could limit movement in the wrist, and this could be one of the causes of carpal tunnel syndrome. Also, we have congenital or congenitally small anatomical space. So in the wrist, we have a space that allows the structures that we call nerves, that we call ligaments, we call blood vessels, that is veins and arteries, to pass through. So that space is covered by the transverse carpal ligament. So it was shown to you earlier on. It's like a sheet that covers and protects the structures. So when this structure or this space is smaller, there's a likelihood that there could be compression of these structures, and this could lead to inflammation, and this could lead to pain, and then it could cause carpal tunnel syndrome. So this is a third cause. The first one is inflammation. The second one is fibrosis of the structure or the flexor tendons that helps to bend the wrist forward. The third is the congenitally small anatomical space. That is the space that the structures pass to and small, and this is mainly in females. So females are said to have a smaller congenital anatomical space, and they are, according to prevalence, they are mostly affected. They have a high risk of having carpal tunnel syndrome. And then fourthly, we have something we call lesions. Lesions, they are various conditions or their infection that could lead to us having this condition called carpal tunnel syndrome. We have cysts. So cysts are small masses that are formed in a particular part of the body. So as we are talking about now, the wrist. So if we have cysts in the wrist, we could have an inference of a carpal tunnel syndrome diagnosis. Also, we have something we call neoplasm. Neoplasms are tumors or small rounded masses in the wrist, and these could result in carpal tunnel syndrome. Last but not the least, we have systemic illness. One very common illness is the rheumatoid arthritis. So this is an autoimmune disease. When you say autoimmune, it means the body produces its own antibodies to fight against itself, and this is called autoimmune. And so when this happens, there's inflammation around the body, and if it's the wrist, it could cause carpal tunnel syndrome. So then, after the causes, we are now going to the risk factors. So risk factors are, what are the factors that could mean that you are likely to have this condition called carpal tunnel syndrome? Yes, so one factor is obesity. Obesity is not linked to how fat you are, but is as a result of, one, your height and then your weight. So we measure obesity as height over weight. So when you have a value of more than 30 by calculation, that is height over weight squared, then you are likely to be obese. So obesity is not, when someone tells us that you're obese, it doesn't mean that you are extremely fat. Someone can be fat, but it's not equivalent or it's not equal to being obese. Secondly, a female gender. So as I said initially, females are mostly predisposed to this condition called carpal tunnel syndrome because of the fact that they are likely to have congenitally small anatomical space. That is, the space that the structures pass through are likely to be small, so their research shows that they are likely to have this condition. Also, pregnancy. So a woman who is pregnant is likely to also have carpal tunnel syndrome. Why? Because they're showing that symptoms of pregnancy tend to cause the wrist to get swollen, and then person could have carpal tunnel syndrome. Also, someone having diabetes can also have carpal tunnel syndrome. Also, we talked about the fact that rheumatoid arthritis, that is the body fighting its own self by autoimmune mechanism. Also, we have hypothyroidism. So we have low thyroid in the body, could also cause carpal tunnel syndrome. We have so many conditions. If you have inflammation of the tendons around the wrist. So in the wrist we have tendons, and then these tendons helps also the wrist to move. So when in case where they have been inflamed or they are swollen as a result of maybe an accident or trauma to the wrist, they could have carpal tunnel syndrome. And also genetic predisposition. So it could be that in your family you have this condition, you have pain in your wrist, that is carpal tunnel syndrome. So they're likely to have this condition. So first of all, we need to assess as a medical practitioner what are the history, what are the cause, what happened, and then before we can diagnose this condition. So in addition to some of the symptoms include paresthesia, as we mentioned, person doesn't feel well on the affected side. So if this is the wrist, the thumb, when you touch the thumb doesn't feel normally, it feels differently from the other side. If you look at the index finger too, it feels differently from the other side. If you look at the middle finger too, it feels differently. If you look at the ring finger, that is the ring finger closer to the thumb, the half portion closer to the thumb feels differently from the one away from the half part of the ring finger away from the thumb. It feels differently. And then also the person has weaknesses or clumsiness of the hand. So when you ask the person to hold something, the person cannot hold it very well. The person has weak grip strength. So if you give the person, maybe hold this. So if this is a power bank, yes. If you ask the person to hold the power bank, the person cannot hold it well. It feels shaky. The hand feels shaky and cannot hold it well. And then when you ask the person also to write, the person has difficulty in terms of writing. And these are some of the signs of carpal tunnel syndrome. The person also has aching pain in the wrist. Sometimes goes to the forearm, goes to the palm. And these are some of the signs or some of the symptoms of carpal tunnel syndrome. The person has the wrist. The person sometimes cannot do anything with the wrist. It's very difficult. And so when we notice this, we are supposed to carry out various examinations to be able to diagnose this condition. First of all, we need to get the history. What happened to the person? The person have an accident? The person break the wrist? Did the person diabetic? Is the person what does the person do? Does the person carry things? Does the person write a lot? Does the person type a lot? So these are some of the histories taken that will also infer us to diagnose this condition very, very effectively. Okay, so first of all, we now assess the patient and find out. So we check the area, if the wrist. So you put a hand there. Does the place feel warm? Is the place swollen? Is the place red? And these are some of the things that will help us to be able to diagnose this condition. And then we'll check the feeling. Does the person feel very well there? Yes, and if not, then we can also carry on to move the wrist. Does it feel pain when you bend? Mostly when you bend the wrist forward like this, it causes pain severity to increase because of the fact that the median nerve is located at this portion of the wrist, in front of the wrist. So the median nerve is located in the wrist, this portion of the wrist. So the person is likely to feel pain by bending more than stretching. Okay, so after finding out all these things, we as physical therapists also have our own special tests that we do. But before that, we could opt for X-ray, we will opt for MRI, we will opt for CT scan to be able to conclusively diagnose this condition. So as physical therapists, first of all, we're going to do some tests. So we have about 3 tests that we do. The first one is called the Phalanx test or the reverse prayer test. So we ask the patient to ask them to behave as if the patient is praying. So it closes the okay, so I just want to demonstrate a little of it. So you could see the person doing this. So the person praying, so the prayer sign, so as if he's praying. So the other palm joins this way, as if the patient is praying. So this, when the patient acts as if he's praying, he can't close both hands together. And this could infer that there could be pain or there's some sort of impingement or inflammation in the wrist, and this could be a sign of carpal tunnel syndrome. So another one is also called the Tinel's test. Tinel's test. So the patient also bend the wrist this way, and then join the other one this way, and then brings them together. So when the patient expresses pain in the wrist, that is basically around the side, we could infer that the person has carpal tunnel syndrome. And so we have other ones that we could palpate the wrist. So when you put the wrist around, you put a thumb around this part. So if I put my thumb around this part, I could feel pain. The patient complains of pain in the wrist. Also, we have hand diagram. So we have a pictorial presentation of the wrist. So the patient points exactly where the pain is, and then we can say that the person could have carpal tunnel syndrome. So in order to not to bore us with the talk, we're going to look at some pictures of so far what we've been talking about, and I'm sure that we'll have a better understanding of the condition. Okay, so yes, so this is the carpal tunnel. So this is the transverse so this is the transverse ligament. Yes, this is the transverse ligament. So it covers the structures. So as I said, it covers the structures. This is the tendon sheet, and this is our nerves. This is the median nerve, the very important nerve. So that's the median nerve. It crosses from the forearm through the wrist. So it passes under the transverse carpal ligament, and then it bifurcates. That is, it spreads out into the palm. So you can see the nerve here, the big nerve here. Yes, this is a big nerve here. It goes and then spreads out. Yes, I'm sure we can see it spreads out. The yellow one is the median nerve. So it spreads out into the palm and then goes directly into the finger. So you could see one here. Yes, one into the thumb. So it goes into the thumb, and another one goes into the index finger. It goes into the middle finger. Then the last one goes into the ring finger, but it goes into half closer to the thumb. And so when this structure is inflamed, the nerve is inflamed, or there's tumor, or there's a cyst around the nerve, or there's an injury in the wrist, you could, when you touch the ring finger, this portion of the ring finger, the person doesn't feel too well there. It doesn't, the feeling is different from the feeling expressed in the small finger, and so there's likelihood of a person having carpal tunnel syndrome. And also we have a presentation in scientific term we call atrophy, where the structures around the palm, that's the muscles, become small. So this structure is called the thenar muscle, and this gives us ability to hold and to be able to use our thumb very effectively. So when this structure becomes small, by scientific term atrophy, it could infer that we have a condition called carpal tunnel syndrome. But then other tests also are important to be able to diagnose this condition. Okay, so this is another picture of the carpal bones, yes, and then the flexor tendon, the median nerve going out into the thumb, and then the index finger. Yes, so we can see a very detailed form, and these are the carpal bones. So we have the pisiform, we have the lunate, we have the trapezium, we have the trapezoid. Yes, so many bones in the wrist, and this helps us to be able to hold and to move our wrist very effectively and connect the finger and then the palm to the rest of the body. So this is the carpal tunnel syndrome, and this is also another picture. I'm sure we can appreciate it well. So you could see a bluish presentation here that shows the sensation, the feeling. So the patient, where the blue is where the feeling is. So the patient doesn't feel too well when you touch this part, but the small finger there's no shading at the small finger. That shows that the sensation is very good there. Yes, okay. And then this is a very, very expressive presentation. Yeah, I'm sure we can appreciate it the more here with this one. Yeah, so this is it. Yep. And let's look at some few more. Yes. So this is the median nerve. It crosses out into the palm. Okay, so these are some of the pictures. Yes. And this is the anatomy of the wrist. Okay. Yes. Okay. Yep. Okay. So back to continue our discussion. Yes, so we are talking about the condition carpal tunnel syndrome. Yes. So we go on to the next. So we've been talking about the anatomy of the wrist, that is inferring the condition carpal tunnel syndrome. We're talking about the science and symptoms, talking about the prevalence, that is which people are affected, and we said the females are mostly affected, mainly because they have a small space we call congenital anatomical space in the wrist, and this helps to compress the nerve, and we can have carpal tunnel syndrome. Okay, so after the tests, we could also have investigations to be done. So we take x-ray of the wrist so that we can rule out in terms of if there's any fracture, that is the bone broken in the wrist. So if there's a bone broken in the wrist, then we can early on splint the wrist or put POP in the wrist so that there is no spread of the bones, or there's no further injury to the wrist. Okay, so we talked about the various special tests that we did, and then the fact that x-rays can also help us to rule out any fracture, and then CT scans will help us to rule out any other condition in the wrist. Then we can treat the condition as carpal tunnel syndrome. So we have various outcome measures. When we say outcome measures, there are various questions that are answered on the first day of the treatment, and then subsequently we can track the recovery process. If there's need for more therapy, or if there's need for surgery, then it will be done. Also, we have something we call nerve conduction studies. And this helps us to be able to see how moving how effective or how efficient the nerve called the median nerve is. So we have tests that we do, and then we have also electromyography. These are various investigations that are done. We call it EMG. This helps us to see the activities of the structures in the wrist, and this helps us also to assess the impact or the level of severity of the condition called carpal tunnel syndrome. We have MRI. MRI gives us a very detailed presentation of the wrist, and this helps us also to further conclusively diagnose the condition. So then we move on to differential diagnosis. Yes, when we talk about differential diagnosis, it means what are the conditions that could mimic or could act as if it's carpal tunnel syndrome, but actually it's not carpal tunnel syndrome. So then we can say as differential diagnosis. So we have cervical spine disorder. So we can have injury to the neck, and then it could come down as far as to the wrist and to the fingers, and you could think that is carpal tunnel syndrome, but actually it's not carpal tunnel syndrome. It could be so many conditions, and we could have brachial plexopathy. We have a condition called Erb's palsy. Okay, so this is a secret, and then this could help us to rule out these conditions. We have so many conditions that and fractures. So if there's no fracture, then we can say, oh, then let's zoom in to talk about to find out exactly whether it's carpal tunnel syndrome. So these are various differential diagnoses, and then now we'll be talking about the grading. So carpal tunnel syndrome is graded into 3 forms. So we have the mild, moderate, and then severe. So when we have someone having carpal tunnel syndrome, we don't just say person have carpal tunnel syndrome. We grade it under severe. So the mild type of carpal tunnel syndrome, where the person has numbness, tingling sensation, discomfort around the wrist. The person doesn't feel well in the wrist at the spots that we talked about, or the thumb, the index finger, the middle finger, the ring finger, that is the one they have closer to the thumb. And then also with increasing activities, the person finds difficult to perform tasks, or very, very minimal effect during performing tasks. The moderate one, person also has sensation deficit. The person also can't hold things. The person's hand function, that is using the hand, it's not effective. And the person is not able to perform some activities of daily living. That is something like writing, like raising things, or picking relatively heavy items. The severe type, the person actually cannot do anything at all, cannot even hold even a pen. It's very difficult, the person gripping a pen or even writing. Sometimes sleep is disturbed. The person cannot sleep because of the pain. The pain is so severe that it interrupts the person's sleep. So these are the clinical grading of the condition we called carpal tunnel syndrome: mild, moderate, and severe. So now we're talking about the treatment. So in everything that we have treatment. Anything that there's nothing that is not treatable or manageable. This condition is manageable and sometimes treated when it's seen very early. So first of all, we go through conservative treatment, that is using physical therapy or modification of life factors, that is lifestyle modification. And then when it's very severe, then we go on to surgery. But some researchers say that surgery is quite effective during the early stages to be able to effectively treat this condition. Other mode of or other theories say that physical therapy or conservative treatment is also highly effective to treat this condition. But then we look at the non-conservative or physical therapy means. So we have exercises such as cold compress. So the first week, if it's acute, that is the first 3 to 7 days, that is, we call this acute. We use ice, so we ice that side, and then we rest. We prevent movement in the wrist, so we can use something we call splints. So this helps to prevent too much movement in the wrist. So we ice that side, and we can bandage that side to limit movement in the wrist, and then this helps the healing to be very, very effective, and then also relatively faster. So in the essence where there's also good movements or relatively better movement, we can also do something we call nerve stimulation. So this helps to prevent or to reduce swelling, also, and to relieve pain. And we also have gentle massage. So if there's swelling there, we can do some gentle massage to be able to relieve swelling and then also relieve pain. Massage is very soothing, and then this helps to also improve the range of motion, that is the ability of the person to move the wrist out and in or sideways very, very effectively. Okay, so then also we have also manual therapy. So we have joint mobilizations, various techniques that as a physical therapist or physiotherapist will do to be able to alleviate the pain and then to improve upon function. Yes, so then when all this is said and done and it's not possible, then we go on to surgery. Yes, sometimes surgical means comes early, but when surgical means it doesn't come early and it's very severe, nothing can be done about it. We go through surgical procedures. We could have decompression of the nerve or the structures around the side, and this could help to relieve pain. We have if there's a fracture there, we could have also POP around the side to be able to ensure that there is effective healing of the bone and the bone is fused and very okay before allowing movement of the wrist. So we have so many surgical means. Yes, so many surgical means. I can run through some. We have surgical decompression. We have surgical release of the carpal ligament. So as I said, the females have a relatively smaller transverse carpal ligament, and so surgically we can enter into the process of relieving the pressure in the wrist, so that allow the structures to move freely without force. So these are the surgical means. Okay, so some of the lifestyle modifications. So what are we supposed to do so that we don't we are not likely predisposed to this condition called transverse that such as carpal tunnel syndrome. Yes, so this is very important. So carpal tunnel syndrome. So some of the lifestyle modification include I want to be very specific. Some of the lifestyle modification include you avoid repetitive motion. So if you're a banker and you're typing too much, you try to moderate your typing. You type a little, then you relax your wrist a little. And also you have to take frequent breaks. So those who type a lot, those who write a lot, you have to break in between your work schedules so that you can rest your wrist. And also the use of ergonomic equipment, that is modification devices, so that we can make the work effective and we don't overwork or don't overuse the rest. Also alternate job functions, so you can do variable tasks. You write a little, you go and do something else, and this helps to also relax the structures in the wrist and then prevents one from having carpal tunnel syndrome. Okay, so you've talked a lot, you've mentioned so many things. The prevalence that women are more affected than men. Age too can be a factor. So as you go old, the structures around the wrist could be relatively weak, and then it could cause one to have carpal tunnel syndrome. But when we do notice this condition and we report it early, then we can have a very, very effective treatment. We also have ultrasound therapy to help relieve the pain. Okay, so thank you very much. Thank you very much for your time. I will leave us with a quote, a very important quote. It says, "Life is not measured by the breaths. Life is not measured by the breaths you take, but by its breathtaking moments." Life is not measured by the breaths you take, but it's measured by its breathtaking moments. So we can ponder over this quote. It's very important that we take very important decisions in our lives. Thank you very much, and I'm glad that we've learned a lot. Yes, you talked about carpal tunnel syndrome, and I believe that we are well able to tell others about this condition called carpal tunnel syndrome, and we'll see you in the next presentation. I'm so glad that you stayed on to listen to. Thank you very much, David, Shimal, Miss Tablet. I don't know your name actually. Thank you, Genevieve. Thank you, thank you, all my classmates. Yes, all my classmates for listening, and for the flyer. Thank you very much for the flyer. You know yourself. Thank you very much for the flyer. Thank you very much, you all. May the good Lord be with us all. Have a blessed evening. Take care. See you. Yes, and the next topic is very important. One of my very favorite topics is obstetric brachial plexus injury, OBPPI, obstetric brachial plexus injury. Okay, OBPI. Yes, OBPI, obstetric brachial plexus injury. So that's our next topic. I'm very glad that you listened, and I'm sure that our next presentation will be awesome, will be very interesting, and then you'll be very insightful and educative. Thank you very much for your time. Have a blessed evening. Goodbye. We love you. Have a blessed evening. And please, do you have any questions? Any questions? Any questions, please? Just some few seconds, about a minute. Any questions, please? Yes. I'm sure you've learned a lot. Carpal tunnel syndrome. Carpal tunnel syndrome. Please, any question? Any question? Yes. Any question? Any question? I'll be glad to answer. We have about a minute to ask questions, and then we'll close for this presentation. Carpal tunnel syndrome. Carpal tunnel syndrome, CTS. Okay. Thank you very much for your time. Have a blessed evening. Take care. We love you. Goodbye. Have a blessed evening.